Good afternoon, everyone, and welcome. We're delighted to have you here on behalf of the Margaret Pyke Trust and the co-organizers of this event, MSI Reproductive Choices and Population Services International, PSI. Welcome to this session on funding at the intersection of climate and health, unlocking investments for women and girls to build their resilience and leave no one behind. We're here to talk about women and girls, especially those in last-mile communities in low-income countries who are experiencing the harshest and most violent effects of climate change. These are also the women and girls who are least able to access health care, including reproductive health, which we know to be vital to a myriad of aspects of women and girls' lives, from their health to their education and their overall empowerment. These women and girls live in areas that we know to be very reliant on the natural resources surrounding them for their livelihoods and their lives. The scope of this problem is huge. There are 218 million women and girls in low and middle income countries who have an unmet need for voluntary and rights-based family planning and other life-saving sexual and reproductive health services and commodities. The 30 countries in the world that are most vulnerable to climate change largely overlap with the 30 countries with the highest levels of gender inequality as well. Gender, health, livelihoods, and climate change overlap and create a perfect storm on the ground in these communities. This means that the solutions, the adaptation and resilience building strategies that we need to put in place must be equally complex, multi-sectoral, and gender transformative strategies. We know that the integration of sexual and reproductive health and rights is one of those strategies. Women and girls are demanding it, and the data is supporting it. This is something we've been advocating for at the Margaret Pyke Trust for 10 years now, and we develop programs on the ground that address these challenges in an integrated manner in Uganda, and we have plans to scale them up with some of the partners on the panel here with me today in Mozambique, Zambia, and elsewhere. The IPCC, the Intergovernmental Panel on Climate Change, has recognized that improving reproductive health is a pathway to climate resilience. It is a fundamental pillar of individual and community adaptation, especially in last-mile communities. And as climate change advances, this will only get harder for women and girls. In fact, an MSI study in 2021 across 26 climate-affected countries found that since 2011 alone, an estimated 11.5 million women and girls have had their access to contraception disrupted due to climate-related displacement. We also know that currently only 0.5% of multilateral climate finance is allocated to improving health outcomes, and very little of that 0.5% is flowing to sexual and reproductive health and rights. That is also because sexual and reproductive health and rights do not feature in nationally determined contributions. It has been a resounding message throughout this COP29 that SRHR must be integrated. The evidence is there, and it is clear. So this issue is not a side event issue. It should be loud and clear on the main stage, because women and girls in continents such as the African continent, but also in Asia Pacific, produce up to 80% of the food supply. They are also responsible for their households and their families. They have a deep understanding of the effects that climate change is having on their land, their soil, their harvests, their water supply, and on their own and their families' health. Therefore, we must invest in women and girls' health now. That is the main message of this event. We're here today with a very distinguished panel to present evidence, experience, and clear calls to action on why this investment is more important than ever, and it cannot wait. So with that, I would like to hand it over first. I'd like to start in East Africa. So I'd like to hand it over to my colleague Namakando Simamuna, who is responsible for partnerships and projects at Maristope, Zambia. From your perspective, Namakando, what you're seeing in your country, why, from your experience of programs, of partnerships, why is it more important than ever that we invest in women and girls at the intersection of climate and health to ensure we leave no one behind? Namakando, thank you. Over to you.
Thank you so much, Carina, and good afternoon, everyone. I am happy to answer the question by giving very practical examples of how climate change directly impacts health in my country. Now, it is more crucial now to invest in resilience because we see it more clearly how climate change impacts health in very straightforward and clear paths. In Zambia, since the climate crisis was declared a national disaster early this year, we have seen the health system be challenged in various ways, be weakened in various ways. And we have also seen in places where we're providing sexual and reproductive health services as MSI Reproductive Choices and meeting women and girls in the front lines of climate change, we have seen how women and girls bear a disproportionate burden of the climate crisis. And this is more so because they are often responsible for for providing food for their families. They're responsible for essential health care. And so when the climate shock hits them, their resilience is really put to the test. And we do see that, highlighting the need for increased support and funding for women and girls. I would like to share what we have seen in game reserve and conservation areas where we are partnering with the Frankfurt Zoological Society, providing sexual and reproductive health services and protecting the rights of women to access sexual and reproductive health, quality sexual and reproductive health services in those areas. In this place, we have an innovative project where we are bringing sexual and reproductive health services much closer to the communities to ensure that women and girls do not have to walk very long distances and risk encountering wildlife. That's just one example of what they have to go through to access sexual and reproductive services and other services in general. And so we bring them closer, we bring the services closer to the communities. And all of this in partnership with the Frankfurt Zoological Society, embedding climate sustainability messages. What have we seen on the fringes of game reserve areas and national parks is that the climate crisis has, one, it has cut off some areas from the mainland, which has affected supply chain. In very practical terms, there are some places in my country that have been cut off due to floods or deteriorating roads, and as such, the supply chain has been disrupted and essential health services are not able to reach the women and girls. Another way is how the climate crisis has led into an energy crisis, in my country, and that has seen electricity disruption. Now what this means is that some critical infection prevention equipment, such as autoclaves, need a sustainable source of electricity. And when that does not happen, infection prevention is compromised and maternal and newborn health therefore suffers the loss. Another way we have seen this in very practical terms in my country is that the energy crisis has also led to compromised pharmaceutical storage, right? So when power disrupts, you find pharmaceutical storages, temperatures getting really high and temperature-sensitive medicines being compromised, therefore compromising efficacy as well. But more closely to the conversation around gender equality is how you see the picture getting very gendered. In areas where the MSI Reproductive Choices outreach teams are providing services, we have been told of stories where school heads, because now we provide services to even nearby schools in the communities, where a particular school head walked to our teams and told them about how they have observed a trend where, since the climate crisis now has threatened food supply, we have seen that the income in homes has reduced. What that means is that parents who would then provide for their children have reduced the amount of money or at all giving their children, and adolescent girls have been seen to begin having sex with older boys and men for money. That has translated to increased teenage pregnancies, HIV, and other sexually transmitted infections, as you may imagine. The flip side of that, in a different part of the country, is where we have been told of stories where children, adolescents who whose families would ordinarily afford to take them to school are no longer able to take them to school because now they are recalling them back home to be part of the workforce to, increase incomes in their homes because then there's crop failure. And so there's need for more people to work and bring money back home. And the worst is that adolescent girls, some of them don't only get recalled to engage in economic activities, they are in some cases married off for that extra income, which exposes them to more poverty, to teenage pregnancies, and all these infections and health risks that come with it. I just want to say, therefore, to answer your question, that this shows the more need for increased investment, targeted investment for women and girls as they navigate the climate crisis. And as investing in reproductive health only adds value to the whole conversation around resilience. There is no resilience if we ignore reproductive health, and ignoring reproductive health only undermines the whole agenda of resilience. We need to ensure that services are continued to be provided where and when women need them. Thank you.
Thank you so much, Namakando. Absolutely. They need to be invested in, they need to be part of the solution. I think you highlighted extremely well from a practical level how interlinked crises need an interlinked response and why that is. I'd like to stay in East Africa now and I'd turn it over to Richard Mugenyi, Communications and Advocacy Manager at Reproductive Health Uganda. Richard, from your perspective, what have you been saying and why is it therefore more important than ever that we invest in women and girls at the intersection of climate and health?
Thank you so much. Good evening. I think what we've been seeing, and of course, what from the introduction, from her sharing, one of the things we've been seeing that we need, there's a need for continued learning, unlearning, and relearning. And if we are to invest, to increase investment in SRHR, the integration between SRHR and climate change. And the thing is, many times, like you noted in the introduction, when we look at our national adaptation plans, SRHR is missing. Even when gender is included, it's just maybe a sentence or two that talk about gender. And so when it comes to investment, we are not investing in it. Yet we know that actually when it comes to, like we know, women and girls and young people are more affected. So we need to increase investment in advocacy, engaging the policymakers so that they invest in SRHR, women empowerment, and even when we've seen that when disasters strike, I come from Uganda, almost every year we know that in certain parts of Uganda there are floods due to climate change, and when the floods come, communities are displaced, and when the communities are displaced, less investment or less focus is put on SRHR, including gender equality. So that's why we need to continue the learning and unlearning how we used to do things for emergency purposes. But also when it comes, and that's looking at advocacy and looking at the power holders and decision makers. But when it comes to women, how do we make sure that gender equality comes up strongly? Women knowing their rights to women and young girls, making sure that their rights are respected, but they also know about their rights. We do a lot of, when we are engaging young people, we look at sexuality education. How do we make sure that young girls can be assertive? They can have those skills where they can be assertive, where they can say no, because she talks about teenage pregnancies increasing. Because, I mean, when they are displaced, they're going to these camps, or when the famine comes, I mean, they turn to these girls, maybe are going to marry them off. But when they have the assertive skills and they can say, no, I want to continue with school, that means this girl is going to delay a pregnancy. And again, the women, when we engage them and they know their rights, they can't say no to certain things. They can say, yes, I have to keep this money for my family. I'm going to take care of my family. Knowing the husband taking the money, then I think that helps to reduce the effect of the impact they feel due to climate change. But also, we need to engage the men. And I think a lot of unlearning has to go into the men. We are discussing that, there are many, I was reading about this story of this man. When he grew up, the father wanted to have many women, and the man used to say whatever he wanted. He would come back home when he wanted, and even when the woman would go and work, he would decide what to use the money for. And even when he comes back, he's drunk, he has taken all the money, he's going to beat the woman because there's no food, yet he took all the money. Now, how do we engage men to unlearn that old culture, their old thinking and attitudes towards bringing up a family and towards resource sharing, decision making at home as a family? How do we engage men so that they unlearn those? And when disaster or when we into crisis, people get stressed. And when the men get stressed, they turn to the women and the children at home. They will beat them up. They don't want to see them. They don't want to do anything with them. They think of themselves. So how do we make sure we engage the men to unlearn such practices, such old cultures, so that we achieve that gender equality? So it's one of the things that we are looking at when we are looking at climate change and SRHR. And for us, we want to, normally one of the things we look at is to make sure that we increase investment. When we are looking at climate change, we just not look at mitigation, but increasing adaptive capacities and resilience, and we need to invest in women and girls. Thank you.
Absolutely, Richard. Yes, we need to invest in women and girls. I think Uganda is an excellent example where certain aspects of SRHR, particularly reproductive health programs, have made it into your nationally determined contribution as a priority adaptation target. And the second point that you raised that I think is so fundamental is that of male engagement, and where we do have examples of integrated programs that are looking at the environmental issues and the development issues and the gender issues. One of the reasons they have been successful in several countries around the world, and that's why we're advocating to scale them up, is because they integrate that messaging. So bringing women and girls and men along to the conversation and having integrated community messages where they see, men and women see, what's the importance of improving human and environmental health, what are the bigger effects, the development impacts that we can see from having an integrated approach. So those are very important points indeed. Thank you, Richard. I'd like to turn now to Alison Malmquist. She's the Vice President of Global Fundraising and Communications at PSI. And I'd love to hear from Alison, have her reflect on what a lot of the conversations we've been having over the past year or so, the case that you're making within PSI and the case that you're making at COP29 and more broadly on why these investments are so important. Thank you, Alison. Over to you.
Thank you so much, Carina, and to all of my colleagues and friends on the panel and everyone for joining us today. If you had asked me a couple of years ago if I thought SRHR had a place in a climate conversation, I would have said, quite honestly, I don't know. I don't know. And so, started to explore what that could look like and why that might be relevant. And it really occurred to me that in our programming and as we're working with women and girls, they don't live their lives in silos. They live their lives, within communities, within an ecosystem, within an environment. We work with girls and women worldwide, and particularly with adolescent girls, and we're talking to them about their futures. And I sort of naively asked many of the adolescent girls we were working with, changing climate change, does that resonate with you in any way? Is this something that you're thinking about as you're thinking about the future? And I have a 16-year-old, so all of them said, absolutely, we know. Thank you for figuring this out, but we understand that things are changing around us. It's not a future thing, it's here and now. And because they're living their lives in these communities, in these realities. Our own approaches need to be holistic. And what we're particularly excited about is the opportunity for this to be a catalytic moment for women and girls so that we can work multi-sectorally, because we all care about them and their futures, and they have a really, not just incidental, but fundamental to all of the exciting initiatives that we're hearing about here, at COP29 and in other settings. Women and girls are going to be drivers of many of the changes that we want to see. I had the opportunity to attend a session at the WHO Pavilion, and it was a group of students from the University of Cairo who are doing a COP simulation and came with a declaration really making the case for investing in human capital, health, and jobs for a climate resilient future. And there were students from the Faculty of Medicine, from the Faculty of Agriculture, a student involved in policy, and what they were really saying was, how we approach this intersection is going to require a new set of skills, a new mindset, a new way of thinking, because the level of complexity that we're observing, both driving the changing climate and the impacts that result from a changing climate, exceed any one of us. And so, we must work together, and it was, young people, university students really showing the way, and frankly, they've got a beautiful declaration that ties all of this together with statistics and with geospatial data, really impressive. So, there are important arguments, evidence-driven arguments that can be made. I would also, say, a couple of recommendations to different constituents. Funding is necessary to make this happen. A call to some of the funders to fund a bit more flexibly and with a bit more risk. It is surprisingly challenging to fund truly multi-sectoral livelihoods, agriculture, health, education, sort of as a purposeful, co-designed intervention, something that we're working closely with Margaret Pyke Trust, with Conserve Global, with the Ministry of Environment, the Ministry of Health in Mozambique, to try to not incidentally, but purposefully, with the community, come up with what a holistic intervention looks like. That's hard in the current funding environment where a lot of funding is very verticalized and siloed. As we mentioned, incredibly important to ensure, and as advocates, make sure that health is a priority sector as part of the climate change response. Uganda has blazed a trail, frankly, making sure that they have a national adaptation plan that is explicit to health, and that sexual and reproductive health and rights are explicit within that national adaptation plan. And that now links up to NDCs, which means that we can theoretically begin to access some of the funds that are available, but that's not a guarantee. And so the case must continue to be made that healthy people are what is going to drive a healthier future and a healthier planet, and not incidental, but fundamental to everything that we want to achieve. Thank you.
Thank you, Allison. Yes, absolutely fundamental. We do need that flexible funding, and the data is there. Colleagues from our sector earlier this year said, we know enough to act. And we do know enough to act, and therefore we must. Ban Ki-moon published a quote yesterday saying to not invest in areas of health and in the needs of the last mile communities is to let unnecessary suffering continue to happen. And I think that's why this conversation is so important in driving what do some of those solutions, what do some of those strategies look like, and you're doing an excellent job of laying out what they look like and how we can work together to make them happen. I'd like to now turn it over to Hafsat Aviola Costello. She's the co-founder of Project Dandelion. She's also the president of Women in Africa Initiative and co-founder of Connected Women Leaders. Hafsat, I'm very pleased to have you sitting next to me today, and I'd love to hear from your experience from Nigeria to the United States to the world on why this is such an important topic. Hafsat, over to you. Thank you.
Carina, thank you for inviting me to be part of this panel. It's really nice to see the people in the room and to see that we're all here concerned about young girls. I think largely all of us are here really because of young girls. We know we say women and girls, but you know, so many decisions that are taken happen at such an early stage. I think of one of my dearest friends who is from one of these nomadic groups in Africa. And my African sisters and brothers that are here, you know that often with those nomadic groups, they like to marry their daughters off early. So my sister that I'm talking about, my dear friend, she actually is now 52, 53, and she's blessed with 3 children. But when she was 16, her mother, not her father, but her mother wanted her to get married and felt that she was already too old at 16. And she was growing up in one of the European countries, but the culture, you know, African culture, no matter where we grow up, it's a blessing, but it stays with us. You know, our people want to keep their culture, you know, so our mother was pushing, and the father wasn't pushing at all. But because her mother was pushing so much, and then at a point the mother said to her, you know, would I lie to you that this is for your own good? You know, and you know when your mother starts talking like this in the culture, we tend to just give in. So Mariama now got married at 16, and right away she knew that this was a disaster. I don't know quite what told her. Maybe it was the wedding night, maybe it was how that whole thing went, and many of the nights after. But the guy was always showing his interest in this young bride. I think he was like 3 years older. And so Mariama decided that she wasn't staying in that marriage. And she left the marriage so she could return to school. But she was already pregnant. And through the services of the kinds of organizations that you guys support, she was able to end that pregnancy and continue to go to school. And then, you know, and just build a career for herself. She got married to somebody. She worked at the United Nations, got married to a colleague also at the United Nations from Italy. And, you know, so she's traveled all over the planet. The home that her mother lives in, her father has now died. But the home that her mother lives in now in Guinea-Conakry, please ask me who built it, if it's not our sister Mariama. All she does to take care of her family, we can't even imagine. But sometimes when I look at my sister, and I think, supposing she had been forced to stay in that marriage at 16, or forced to have the child before she was ready to have the child, and that pushed her life into a particular trajectory, how would that have gone for her? And how would that have gone for her family? But the blessing that Mariama is today for her family was because when she found herself in a situation at 16, she had choices. There were choices available to her. And these choices, unfortunately, Karine, they're not available to many young girls across Africa today. Since we're talking, even since COVID. After COVID, right after COVID, with the whole shutdowns across the world, we had 40 million girls across Africa out of school. When girls are out of school, their mothers become like Mariama's mother. The mother starts to worry that very soon the girl will come with an unwanted pregnancy, better that she be married. So they start this whole agitation for marriage. That's if the girl is lucky. Some of the girls that you were describing they don't even have the institution of marriage. They just the pressure around needing to find money to help the family push them into all kinds of situations, and they are left without choices, Karine. The work you're doing, Karine, is so important. The African people, I love them to the moon and back, but we tend to be quite conservative people. We're communal people. Communal people are always quite conservative. But even we believe the evidence of our eyes. And when a daughter like Mariama can grow and start to do important things for our family, the family can see why the choices are important. But what we need is a situation where before this family even sees, before they're convinced, those services have to be in place. Those services have to be in place. There's so many organizations. I know of one example where an American organization was giving money to set up pharmaceutical pharmacies in rural areas in Nigeria to be run by women. Women were going to own these pharmacies. You will ask me why. Can anyone imagine why they wanted women to own these pharmacies? Any of the people here, can you imagine why? Because they wanted, when young girls have questions about reproductive health and they go to the pharmacy, that they should feel comfortable to ask. So they wanted there to be a woman there so that when the young girl comes in, she feels comfortable to ask these very sensitive questions. There's so much work to be done on so many different levels, but the most important thing now, I'm privileged to work with Julie, who is here in front. Julie, could you raise your hand, please? Julie is with Vital Voices. I don't know if you guys know Vital Voices. It's like 25 years old. It's one of the biggest organizations promoting women and girls and our leadership all over the world. We have like 46,000 members worldwide, like presidents. It was started by Hillary Clinton when she was First Lady in the United States. And I'm now opportune to be the lead for climate for Vital Voices. And I want us to look together with you guys at PSI at this question that the whole world has changed and the Africans are the least to blame for the change on the planet. And they're also the most impacted. It's affecting our agriculture. Are there any Senegalese in this room? Anybody from Gambia? Anybody that knows the Senegalese and the Gambians, they know the main food they eat is chebujien. They have many special things they eat, but this one was so special that they exported it across West Africa. And in Nigeria now we have jollof rice. It's actually Wolof rice. And Wolof, who are the Wolof people? They're in Senegal. And they've shared this food with us. It's based on rice. Now they're telling us that rice production in Africa is actually in danger from climate change. And I don't know if anyone has told the Senegalese people this. I don't even know how to tell them this, that their national food that they have carried with so much pride is now in peril. But this is climate change. It's affecting everything, what we eat, what is available to be eaten, what is available to be grown, whether we can even plant, whether we're faced with drought. It's also affecting conflict where people are coming into, so many refugees have been created. They're telling me that across Africa, we're having 45 million people being produced by conflicts, which is caused by heat and so many changing conditions across the continent. When you hear about all these changes, please realize that what we're hearing about are dangers to women and girls. It means they have to go further to get water. They have to go further to get firewood. They have more domestic work. So when they're facing all these challenges, and then we're doing all these pilot projects, what's your name? Alison? I want to close, but I want to say, we cannot work on a pilot level, and we cannot work just in Mozambique, just in Uganda. This is critical. Mozambique is gorgeous. Uganda, I think, is called like one of the flowers of Africa. We know it's stunning. But we have to work in 54 countries, and we have to work systematically. We have to help 1.4 billion people. In 2100, Africans will be about maybe 50% of the world's population. It's because the rest of the world is not reproducing and we're the only ones that are. We're going to be 50% of the world's people. That 50% of the world's people, I want them to show the magnificence of the human agency. And I want them to have available to them all the human choice that humanity has been able to provide in terms of education, in terms of infrastructure, so they can build a life that is worthy. And by that, I don't mean a life that is wealthy, but just worthy, where we take care of each other as we've always done but that we struggle to do now. And a lot of that depends on whether the girl is 16 and when she's not ready and she finds that she's pregnant, are those services available? And for that to happen, we have to work in a systematic fashion. So if my own message to you is this, how do we get the work you guys are doing continent-wide in a systematic space so that in that little village, if there's another Mariama and her mother has pushed her and she wants a change, the change is there.
Thank you so much for that, Hafsat. Thank you. Thank you. Yes, I think we'd be remiss if we didn't have the reminder that those who have contributed the least are bearing the brunt. And we know that giving women and girls choice to access sexual and reproductive health and exercise their reproductive rights is a cornerstone of all of their life outcomes. And that choice is being restricted and will be increasingly restricted as climate change advances. So we have to invest in what we know is a cornerstone that really is catalytic and helps those women and girls continue to have choices throughout their lives, like Mariama had a choice. So thank you for that. I'd like to now turn to Dr. Deepshika Sharma, climate scientist from Population Council Consulting, to really hear about the climate science, the strategies, the vision, and your deep understanding of the sector. Dr. Deepshika, over to you. Thank you.
Thanks, Carina, and thanks everyone for joining us here today. Honestly, I'm glad to see everybody here. The room is not full, which shows that people who are here really want to listen to this session and just not taking rest and they are tired. So that's great, all of you, for joining us today. I would just like to pick up and thank so much for your example. It really has opened, of course, my eyes as well, in terms of I come from a background of a physical sciences. I am a climate scientist, and the whole conversation of climate health since last COP, it's been really amazing. And I see very closely and observing it that, as per the other intersections, this is really picking up, and there is a huge interest in both the sides, both the health scientists as well as the climate and environment scientists. Just to bring some of the, again, other solutions on the table, I would just like to highlight that why it is important to invest in building resilience. First of all, it is essential. What we do at Population Council, we perceive climate change and environmental risks with the lens of justice. It is very important to see all these aspects with the lens of justice and how to achieve the interventions which are sustainable and holistic, as also been mentioned by other panelists already. Some initiatives which we are doing at Population Council, which has been running for past 10 years, is on the population environmental risk and climate crisis. And the initiative exemplifies our commitment to integrate health, climate, and ensuring a voice for the most marginalized, particularly women and girls. And our approach is underpinned by a climate justice lens, acknowledging those who contribute to the least to climate change are often disproportionately harmed in the process. I was just wondering, or bringing on the, that we have been talking a lot about the mitigation and adaptation at various levels. There have been a lot of commitments on mitigation, and of course, Global Goal on adaptations and other programs are in place. What is really missing in this conversation is the pressing need for gender responsive, gender reactive climate finance. We did mention very briefly on the funding structures. We can see what we have observed from our studies is there's a significant gap in support for the work that address both climate change and women's rights, and SRHR in particularly. Surprisingly, only 0.01% of global funding is allocated to initiatives which are targeting these intersecting issues. So there is a huge gap, and if you see very closely and observe, most of the funding, there is a lot now it has been like, we have to create gender responsive climate finance mechanisms. All the interventions are focusing on that. However, in the health space and SRHR, it's very minuscule. Those discussions have not even started. So it's very important and timely as well. Some of the key areas which we have been looking, and I will just share a few examples. I have a whole list, but I'll just share a few considering the time. We did a very interesting study in Bangladesh, disruptions to healthcare services due to, of course, cyclones, climate change crisis, sea level rise. We have seen that, the services force pregnant women to travel, of course, long distances to access them, often leading to severe consequences. And we have also, with the intrusion of saline water, we have seen 20% higher rate of pre-eclampsia cases during the dry season, and that is mainly the consumption of groundwater, which is again a very direct impact of climate crisis, right? Similarly, on mental health also we have observed. In Mexico, we conducted a nationwide online survey with more than 150,000 young people aged from 15 to 24 years. And we found that 42% of adolescents and young adults exhibited mental health symptoms, and more than half of those individuals had also experienced a climate-related hazard. Moreover, women were more likely to experience a symptom than men. Worsening economic and social vulnerabilities is another, focus area which we are looking into. And in one of the study in rural Zambia, we found that extended drought in rural regions increased food insecurity, economical instability, and the women-led households were particularly vulnerable as droughts increased the stress of both income and caregiving. So these are some of the issues and the threats which accompany the climate crisis. Now it is important for us to make a timely intervention to see how it can be intersected with the climate change and also the negotiations which are happening here. Another very enlightening was on the plight of migrant women in climate crisis. One of the studies which was done by and adopted by UNHCR is climate change would displace 1.2 billion people by 2050, which is an alarming situation for all of us. Migrant women face heightened risk, increased gender-based violence. I think that is very, very crucial, which is happening. Even the heat waves which are coming has reported in many of the South Asian countries as well, the increase in the gender-based violence. And limited access to healthcare, food and water and other facilities. One of the case studies we were closely observing were the floods in 2010 in Pakistan, where contraceptives use among women in 4 out of the 5 regions increased by over 50%, and highlighting the critical need for SRHR facilities and services during the disaster relief efforts. And what we have seen, even with the current negotiations on whether we talk about adaptation funds, whether we talk about loss and damage funds, these are post-disaster in most of the cases. We need to prepare before. So we need to have mitigation at that lens, which is missing. We just talk about mitigation from net zero emissions perspective. I would just like to give some examples on our initiative. What we do is we follow very particularly community-centered and locally defined research, where we collaborate with local youth leaders, indigenous organizations as well, to address the specific community needs. Similarly, we work a lot on the open science and data sharing. We have our own, commitment with our population projection models, which is there, which is also part of the IPCC report. So I think it is very important for us to work not only in the climate negotiations or at COP, but also in the IPCC and push these agendas across. I'll just take a couple of more minutes, and just last thing on the strategic programs which we have. We have very interesting programs which we have initiated. One is we call as REACH, which is Research, Evidence and Analysis on Climate and Health Projects, where we are looking into evidence-based health solutions for example, extreme heat, salinity affected areas, droughts, addressing the SRH solutions, nutrition and mental health. Second is on green, which is called Girls' Resilience, Education, Empowerment and Needs Work, where we equip girls and build the skills in green, for the green jobs like renewable energy, sustainable agriculture and finance, and preparing them for emerging green economies. And lastly is impacts, which is integrated models of people and climate across time and space, where we do all different kind of modeling. We are also doing modeling on migration, how the climate-induced migration impact India, we have done a study on Zambia, and so on and so forth. So we have invested a lot in terms of research and generating those evidence. And now we are working with some of the government and trying to see that how we can integrate SRHR in the frameworks which they are developing in the climate change and health frameworks. It is still a far-fetched work. We really need to work very closely with the governments in that space. So yeah, that's what we have been on. Thank you, Karina.
Thank you so much, Dr. Dipshika. Thank you for the work you're doing, because the evidence base is so important. But I think you paint a very clear picture of the increasingly negative reproductive health outcomes for women and girls as the levels of salinity in water rise, but also many other effects of climate change. And the arguments for why that is important for women and girls' health, and how it also improves their resilience, their ability to adapt to the effects of climate change, and therefore to have a life where they have choices and where they can be at the table. So thank you for that. You also brought up climate and health, and that being an increasing focus from the last COP. So with that, I'd like to turn it over to Elena Villalobos-Prats, a technical officer from the World Health Organization, to tell us from the World Health Assembly Declaration on Climate and Health to the ongoing consultation that has taken place this year on sexual and reproductive health and rights and climate change within the WHO. We'd love to hear more from you. Thank you very much for being here. Over to you.
Thank you very much. I have two hats today because I am the Capacity Building and Country Support lead in WHO HQ on climate change and health, but I am also representing colleagues from HRP and the Sexual and Reproductive Health Department, who basically are not here, so they kindly invited me to be here. As you rightly mentioned, in my case, I've been following the negotiations for 15 years together with the WHO delegation, and at the beginning, we were really fighting for people to understand why health was important. So we were even questioned by some member states, by the Secretariat, why is WHO here? This is not a health issue, this is an environmental issue. Now, we are really surprised to see the momentum that health is getting. So for us, I think everything started to change little by little, probably with Fiji as president of the COP21, because then they already launched special initiative on seeds and climate change and health. Then the momentum continued with the UK as president of COP26. They were the first presidency also to promote specific initiatives on climate change and health, looking at building climate resilient and low carbon sustainable health systems. Then Egypt launched this initiative on nutrition and climate action, ICAN. And then last year, the UAE basically surprised the world. They have the first health day. We had the presence of almost 100 ministers of health in the COP. And we had a declaration on climate and health, which now, as of today, has been signed by 151 countries. At the same time, within the health policy sphere, this year in May, the WHA, the World Health Assembly, basically passed a new resolution on climate change and health, which has requested WHO to design a global plan of action on climate and health, which will be approved next year by the Assembly. So I want to bring a positive message. We are seeing that the time is coming for health to be considered not only as a vulnerable sector, but also as the argument that can be used to convince countries that they really need to be more ambitious in their commitments to solve this problem. From the climate change and health team, we have a very comprehensive approach, basically working with health systems, and of course, universal access to health is a priority, and as part of that, sexual and reproductive health and rights should be promoted and are promoted. From WHO, we are proposing a very comprehensive and not fragmented approach to health, So this is very important for us. We don't need to compete between specific topics. This should be a core element of everything that is happening in relation to health. As part of this also, there are specific opportunities that now, as part of the mandate that we have, I am leading this Alliance for Transformative Action on Climate and Health, the ATACH, which is bringing together 91 countries who have committed at Minister of Health level to building climate resilient and low carbon sustainable health systems, with partners prioritizing it, which includes financing institutions like the World Bank, the Green Climate Fund, the Adaptation Fund, around climate change and health goals. So from my climate change and health hat, I see opportunities to better integrate women and girl needs, specifically also looking at sexual and reproductive health and rights as a core human right and a specific element of everything that we are promoting on health. We also have a gender approach. Unfortunately, this is not well implemented. It never got funding, so your point on funding is also very relevant because it's not only about mentioning women and girls in specific project proposals, it's really putting a specific budget line towards those goals. Wearing my hat as part of the colleagues working in the sexual and reproductive and health team, I just wanted to mention that as part of this specific research program, there is a joint effort by the World Bank, UNICEF, UNFPA, WHO. Last year in COP28, there was a specific statement and call to action looking at the impacts from climate change in sexual and reproductive health and rights. And this is very important because really I think the priorities go to action. So it's not, shouldn't be only about speaking and raising the fact that there is evidence, and colleagues also in WHO have done a lot, and I see that you are also advancing, many partners are doing that. So there is evidence, at least we know which is the evidence that is available. We know that stillbirth, there is more mortality, both in women. So we don't need to argue anymore about that. Of course, there are gaps that need to be strengthened, but the real priority now is to move to action. So I'm happy to see that there is, it's not only about the UN, okay? There is all grassroots organizations, NGOs are really coming together to promote this. And really it's important to make sure that we understand, well, maybe I'm too positive, but I think it's going to happen. So let's come together. This is a real priority. Let's be together to promote those goals.
Thank you so much, Elena. Yes, absolutely. If you're positive, then I think we all have reason to be positive. The consultations that the WHO has done, as I said, on climate and health have been very important. Equally, those on SRHR and climate are very important, and will continue as a sector to engage actively in them to develop the research agenda on SRHR and climate as well as the action agenda. So we do look forward to continuing that work with you. Thank you. And with that, I'd like to welcome to the table with us Ramina Khurshid Alam. She is the coordinator to the Prime Minister of Pakistan on climate change and environmental coordination. Ramina, lovely to have you with us. And over to you, please, on why investing in women and girls at this time, more now than ever, why is it a priority for you in Pakistan and elsewhere? Thank you.
Well, very good evening, ladies and gentlemen, and I'm so glad to see more ladies here. So it's women empowerment more, but anyways, very good evening, and thank you very much, dear, to providing me this opportunity to talk about this very important thing, which is not only the important, I think it's the rightly need, a great need, which we all need to sit and talk and discuss and come up with the solutions. And I think it's not one country, it's a global agenda. It should have a global strong agenda. We need to raise this voice because, as you've asked, that why it's important for Pakistan to talk about this specifically, because in 2022 when the floods come, the world's worst flood we have faced. That time, 650,000 women were being, and they were pregnant, so many issues. The woman was the most vulnerable community when it becomes. But although, yes, at the same time, I'm proud that my women are and I think women everywhere in the world are very much having the resilience and power when it comes to disaster, but they stood up. But the things they have suffered from those challenges, when it comes to specifically about health challenges, when it comes to the menstrual hygiene, when it's come to their daughters that traumatize, they've become, and the most important thing, the challenges which they suffer and the violence, and then when they got dispersed and they are in the camps, so many violences, so many mental health traumas, anxieties, long-term, maternal mobility, and the direct results of the food and water insecurity, anemic situations, and unsafe birth, then stunting and worsening in the children, and particularly, so much bigger challenges and lack of education, lack of food, so much challenges which the woman has suffered. But again, loss of land, loss of homes, homelessness and displacement. So there are so many challenges which the woman being suffered in these days, and then economically challenges. So the way Pakistan has had these challenges which we faced in last few years, and now again representing to those all women. And it's not only the women. I'm going to talk about the gender because it's very much important to talk about the gender as well, the health and the climate change. I believe it's not only the health and the climate change, it's moreover about the human rights, about the challenges which everyone is facing. And what about the adolescents? What about the children? And what about the raising issues of the polio as well? And then we talk about so many challenges and that facilities which they are not getting. The right, I would really want to bring in your knowledge that there are in a province of Balochistan, there are every day when we talk about the climate change, the different diseases are being developed. And those different diseases which we are unable to know, in one of our province, there is one fly which there is in Balochistan, which fly, if it bites you, your skin get vanished, and just one medicine can change, and we don't know, the people over there, they don't have the reach or knowledge about that. So reaching towards those areas, that is something which is very important. So I believe the most important is not only the climate change and health, it's very much needed to come up with the mechanism. Now it's time. So for that, Pakistan is doing few things. Just right now, I'm sorry for being late because on our pavilion we have launched today a project which is called Climate Gender Equity Seal Project. And that is, we are talking about the regional approach in that how we can regionally support each other. And then in this way, as my very dear friend, colleague, she have mentioned about the partnerships, I would really want to show that it's not that only international partnerships, it's more about to equip the national people, the midwives, the health sector, because health sector need to be more equipped. It's not a matter when it comes to the health, we need to provide the medicines. We need to equip those people who needs to go and treat those people. They should know that what is the issue, how we can handle those diseases, even few which we don't know, and then to groom more and to equip more to the woman, because there are several areas where only the woman can treat the woman. The doctors can't go because, there are tribes, there are feudal lots where we can't allow the males to be there. So we are working on that, and then we have a BIS program, Benazir Income Support Program. It's moreover a social program in which they are making a woman empower where they can to engage their skills and they can earn from themselves and they can have a reach and the social benefits they are getting over there. And then we have a health card system as well. So, and then very rightly said, when it comes to the menstrual hygiene, which is the biggest challenge for the girls, and especially in the health, and then the issues related, the health issues related to that. So I wanted to share that I'm focusing on the She Power. She Power is one of our projects which we are doing with the support of our country friend with China. We are doing, and that is specifically for the young girls, that to educate them in the rural area about the menstrual hygiene, why health is very important, why it's important to take care. I'm so sure, maybe a few of you don't agree with me, that people are talking about the youth, that youth is the future, but I don't believe in that, because youth is present. The future is the children. The future is the girls. If we want to build a nation, we need to invest in these young girls to tell them that why it's important to look after yourself. When we travel in the plane, the air hostess said every time that please, when the mask dropped, oxygen dropped, put the mask first on yourself and then help other. So that is the thing which we need to tell them, that on the health side, that it's so much important that if you need to look after yourself, because I would really like to take an opportunity over here where all the, I'm so grateful that all the women are sitting on this panel, that one thing which is, we do talk about the breast cancer, we do talk about other, but this is the most silent killer is the cervical cancer, which women came across to know on the very end when it's almost done. Why we talk about the polio vaccination, why we are not talking about the cervical cancer vaccination. That can be done in a very early times, why it's important. You know, so these sort of challenges, I think we, this strong panel can talk more about, and everything under the sun, I think it's related to the climate change. And we need to focus more on the health. Health, when it comes, it's not the medicine. It's not about the diseases. It's before the, like what are the precautions we need to take about it. So with this, I'm looking forward that this Augustus panel can move towards for the betterment. And one thing else, I want to request sitting everyone here that please raise the voice for the regional solutions, for the regional cooperation. It's very much important that we do talk about the loss and damage funds, but I think more important that regions need to be strengthened, and we need to raise a voice to build up with the pressure groups that the vulnerable countries who are suffering, and women and the children and the girls and adolescents and the transgenders, everyone have the right to live, have the right to have the proper real health, climate system, justice, because this is like, it's not, I believe it's now moreover the challenge is the human rights. Because health, everything needed. And in Pakistan, we've added into the constitution of Pakistan, and we are trying our level best in our very, we don't have that much resources, but I think where there's a will, there is a way. And with each other strength, we can come up and learn from the best practices. Thank you very much.
Thank you very much, Ramina. Yes, it is a human rights issue. Gender justice, environmental justice, and climate justice are three sides of the same coin. I don't have three sides, but they are three sides of the same coin. You also brought up a really important point about the regional priorities, and I would say even the national priorities, and the nationally determined contributions are really an opportunity to do that, to get countries to say, this is what is important for us. And the women and girls need to be at those tables to say, this is what is important for us. This is the difference that sexual and reproductive health and rights makes in our lives. Therefore, it must be in our NDC. It must be costed, and it must be budgeted for. So thank you for raising those points. We're a little bit behind schedule, but what you're saying is too great, and I can't possibly cut anyone off. So I think what we'll do now, we're going to have a quick short fire round, and everyone will get 2 minutes to make a final statement, a call to action, what things you've been hearing around at COP29 that you'd like others in the room to really take away and go home with and put into action. So if I may, I'll start on my, Alison, if I may start with you, quick.
I'll be quick. Find your other sectors. Be meaningful and purposeful about reaching across sectors and finding those who are like-minded. Come together, think about what your shared values are, and as Carina said, make sure that it's clear to governments, to financiers, to funders that this is what is important to us, and this is what must be budgeted and what must be funded. Thank you.
Thank you, Alison. Yes, find your other sectors, find your non-traditional allies. I think that's a very important one, because that allows you to bridge those gaps and work across sectors. Thank you so much, Alison. Namakando, your call to action. What are you hearing at COP29?
Open up your spaces to other partners, and this is particularly to reproductive health. Ensure that it's embedded in the national policies, and not just the mention of it. I think it should have clear indicators so that it is measurable and we can hold ourselves accountable as we continue to implement our climate action moving forward. Thank you.
Thank you very much, Namakando. Open up spaces to other partners again, not just sort of a mention, but and hold everyone to account. Yeah, go ahead.
That's correct. I was going to say not just a mention of it, because we have seen it over the years that it's mentioned as reproductive health to be considered, but we wanted to have clear indicators that it's measurable and we can hold each other accountable. Thank you.
That's perfect. Thank you. Richard, one message you want those folks to take away?
Yes, I think if each one of us in this room, we advocate for integrated climate change programming, when we're looking at climate change, even when they're talking about gender equality, it's not about the numbers that including women, but we need to call for that integrated climate change programming, that women are included, but they are empowered to know their rights, not only knowing their rights, but to demand for their rights to be fulfilled, but also to call out those duty bearers like the health workers. Can they provide right-based services to the women that need them, and also including the children to know their rights and they demand for their rights. Thank you.
Very important points. Thank you, Richard. Hafsat, over to you.
I would like my own message to be, I'm sorry, I know you're so important, what you've all shared is so important, but I want my message to be to the Africans in this room. Find your courage. Find the courage, because I know I'm African. I know it's very hard to talk about sexual and reproductive health and rights issues. People, they have this concept of good girl, bad girl, all this, and especially women, when you start talking about these things, people start to think that maybe you are a loose woman or, you have no morals. We're preparing for the future, it's not for us. Find the courage to talk to your families, to our communities. Let them open the space for our girls so that our girls, it would be easy. We don't know where they will be, what they'll need. Let us have opened the space ahead because of the power we have in that family, all the things that we've already done to build our credibility in our family. Let's use all of that credibility now to open the spaces for our young girls, to say to our families so that they're ready when the girl comes and says something. They're ready with the right support. They're ready to say, I can help you. Let's go to the pharmacy together, or let's go to the clinic together. Africa can change. We're already changing, but in the past we've been forced to change. Let's seize the agency and open the rights and the space for young girls so they can embrace the changes that are happening and they have their full agency. We can do it.
Thank you, Hafsat. Yes, agency is so important. So yes. Dr. Dipshika, over to you. One message.
I think I would like to focus and urge everybody to start investing in science. We definitely need to see how we can connect and use this forum to work with IPCC very closely and bring these very important topics on the discussions via science as well. Secondly, is very important is invest, mobilize, finance, not only wait for COP or UNFCCC or these negotiations. We have to start working with the private sector now. Let's not wait 5 years down the line and have those discussions. I see a lot of private sector players here, along with the banks, I think. So we really need to invest our time in science and mobilizing finance. Thank you.
Investing and organizing, yes. Thank you, Dr. Dipshika. Elena, one message from you, please.
I think next year is going to be a critical year for the climate change and health agenda, because countries need to come up with NDCs, they need to come up with NAPs, and they need to come up with long-term low-emission development strategies. So I think the most important will be to find the mechanism to make sure that women and girls are meaningfully represented there, that the needs from women and girls are really sitting in the table, that they are voiced in this space, whether it is in relation to health or it is in relation to overall climate change. But really, this is going to be the critical year. If not, we will need to wait until 4 or 5 years to do so.
And that's not an amount of time that is reasonable to be waiting. So yes, absolutely. Romina, one message from you, please.
Okay, well, thank you all. It's very tough to talk on the last, but anyways, everybody has covered. I just quickly want to say climate justice, access to the funds, to the developing countries. It's very easy to talk about NDCs that do it, but help them to do it. That is like you're asking developing countries to provide the NDCs, but what they are suffering, vulnerable countries. So I think it's more of a social cohesion, regional solutions, climate diplomacy. And if we really want to bring the change, let's empower the girls, invest in them, make them strong, and then we can get the best of the best. And in the end, just lastly, I want to say, in the end, it's not you, it's not me, it's us. So together we can bring the change. Thank you.
Thank you so much for your interventions and your thoughtful guiding comments. I think if you weren't already convinced when you walked in the door that this is a pressing climate and gender justice issue, and if we don't address it, we continue to allow an enormous amount of suffering, and that is just not possible. I think for all of us who are here at COP29, it's a great privilege to be here. I feel it's a great privilege to be here, to be representing state and non-state parties, and I think with that privilege comes equally great responsibility. Responsibility to put into action the momentum that we've created by an action-oriented conversation such as the one we just had. I would like for each of us to go away. Please imagine a future where, yes, of course, we are addressing the effects of climate change, a future in which we are working to be more resilient, to be able to adapt to the effects of climate change, but a future in which at least there's an understanding that if you make an investment such as that of sexual and reproductive health and rights in low and middle income countries, at least there's an understanding that there is transformational power in that investment, that you are enabling choice, you are enabling a woman or a girl to live her life in a dignified way, not just survive, but thrive. And therefore, she's also more resilient in the face of climate change. There is clear science behind that. There is clear support. There's a global alliance that is supporting this, that is fighting for this. And I would really urge everyone to go away and think about how that might be possible within your own organization, within your own government. There are resources. You can speak to Ugandan colleagues who have done this. They've fought that fight to at least get it into their NDC, and will now look to cost that and to budget for that. And there are other countries doing the same. So what I would like to do, because everyone is crazy busy at COP and we'll need to get to another session, I'd like to give us 10-15 minutes of time so that those in the audience can grab someone from the panel that they'd really like to speak to and just have an informal chat and a little bit of networking in this room while we still have it for the next 15 minutes. With that, I thank you very much for you all for being here, and thank you very much to my fellow panelists who are absolutely wonderful.
Hello, everyone. Also, can we just give a round of applause to Carina Hirsch, who's just been working with PSI. You guys are incredible.